Hello, my name is Brian. I'm a family nurse practitioner student with Saginaw Valley State University. I'm going to be doing a bit of an assessment on you here involving your skin, hair, and nails. So to begin, we're just assessing or we're inspecting skin for cyanosis, pallor, jaundice, as well as erythema. So the places we'll check for those. I'm looking at just your general skin for the jaundice. We look at your lips. I'm not seeing any pallor, cyanosis, or erythema. I don't see your nails here. No pallor, cyanosis noted there. And then I'm going to have you open up your mouth. Mucous membranes are pink in color. And then I also checked the hard palate for jaundice in there. I didn't see any jaundice. And then I'm going to look at your sclera. And they're white, which is appropriate, no yellowing, which would indicate problems. And then I also looked at your conjunctiva when I was in there, and those were appropriate colored as well. So, start with your neck. I do see a couple scattered nevi. I don't see any hypo or hyperpigmentation. And then looking at your upper extremities, I see tattoos. So I'm going to assess anterior and posteriorly. I'm going to palpate. I'm feeling first with the back of my hand as I'm inspecting, and just feeling for warmth or coolness, any change in temperature. And then I'm also feeling the fingertips individually with the back of my hand. And now I'm going to use my fingertips. And I'm feeling for skin texture, any changes. It's all smooth, hair distribution is even, no lesions. And I'm also feeling for moisture. I'm going to do that on the other side now. Skin is warm. Alright, and there's no temperature changes, difference between the two, they're both symmetrical. Alright, moist, and they all have a smooth texture. Next, I'm going to look at your trunk, and like I said, I see some scattered nevi. We'll use the ABCDE method to look at a couple of those here shortly. Looking at your back, once again, a few scattered nevi, but no lesions. Go down to your legs here, lower extremities, feeling for warmth. As I'm inspecting here, okay, I'm gonna take your socks off here. All right, not able to check for cyanosis in the nail beds because they're painted, thick nail polish, can't see through. Let's see. Alright. Legs are moist as well. Skin texture is smooth. No lesions noted. Alright. So I'm going to see the back of your hand here. I'm just checking for skin turgor. Alright, and there's no tenting. And now I'm going to inspect your scalp and your hair. No, you're fine. I'm feeling the hair. It's evenly distributed. It's smooth. It's not brittle at all. There's no signs of hair loss anywhere. And then looking through to your scalp, also not seeing any lesions, no mites. I don't see any navi or anything in the scalp. And then, oops, sorry, Dix. I'm gonna see your fingernails. I'm just palpating your fingernails. There's no brittleness noted. They're symmetrical on both sides. No clubbing is noted. And then gonna look at your toes here, palpating. Once again, I can't see the toenails. They're all present, but they're covered with fingernail polish, so difficult to assess. And then the only other thing that I would do is if you were a dark skinned person, I would check the palms of your hands and the soles of your feet for pallor. That's how you do it in a dark skinned person, dark complected person. But you normally inspect those throughout your inspection on any individual just to make sure there's no sort of issues there. And then lastly, just moving on to this navi right here. So using the ABCD method, or excuse me, ABCDE method, you first would note that it's symmetrical, so it's not asymmetrical. The borders are clearly defined on it. It's brown in color. And then I have the centimeter thing here, so the diameter is 4 millimeters. And then have you noticed any evolution of it or any changes recently?
No.
Alright, then we would just reevaluate that at our next visit, or if you notice any changes in coloration or size, or heavy redness around it or pain, then call and let us know. We can look into it a little further. Alright, thank you.